Good morning, everybody. Welcome to this webinar, which will discuss the approach to and the findings from the review of social work governance and assurance across Scotland for 2024. Just before we start today, I just want people to note that we're recording the event and we'll place this on our website. We're conscious that as it edges closer to summer holidays, some people weren't able to attend today, so we just wanted to make sure people had access to the presentation as much as possible. So we'll share this on our Care Inspectorate website in due course. If you can move the slide on, please, Ashley. Thank you. So this is roughly what the plan is for today. So I'll do a few introductions shortly to the other presenters, but over the course of about the next hour or so, we'll talk you through what the approach was to the review. We'll go into a little bit of detail about the key messages and the key findings from the review activity. After we've done that, we're going to have a stab at doing a few polling questions just to make it a little bit more interactive, and there'll be a question and answer opportunity at the end. Just to note that I think I'm right in thinking that the question and answer option is open now, but we won't deal with questions and answers as we go along. We'll do that at the end if that's okay. Okay, hope that's all right with everybody. So just before we start then, I'll just let my colleagues introduce themselves. So my name's Tim Ward. I'm a Strategic Inspector with the Care Inspectorate, and I was lead for this particular review. And I'll just ask my colleagues to introduce themselves. Belle.
Good morning, everybody. I'm Belle McEwen. I'm one of the Strategic Inspectors in the Care Inspectorate and part of the review team.
Thanks, Belle. And James?
Hi, folks. I'm James Black. I'm one of the Strategic Inspectors in the Care Inspectorate, and I was also part of the review team.
Thanks, James. And Susan?
Hi, I'm Susan Kelso, also a Strategic Inspector, as my colleagues and part of the team.
And the genius that is Ashley?
Morning, everyone. I'm Ashley Martin. I'm the Strategic Support Officer that supported the team with this review.
Yeah, couldn't have done any of this without Ashley, who's really central to what we do. So thanks, Ash. Okay, so if we can just move on to the next slide, please. Okay, so just to talk you through the timeline for how the review was undertaken, we issued a letter of intent on the 24th of May 2024. It's amazing that was a year ago now, but that's when all of the activity got going. We formally notified on the 15th of July last year, and then we undertook the review activity during the period from July to November 2024. We then had an opportunity to analyse all the material that we gathered and started report preparation during the period December 24 to March of this year, and then we published the report finally on the 6th of May 2025. Thanks, Ash. So the focus for the review and what we call the review question was how well do social work governance and assurance arrangements support leaders to firstly ensure that statutory duties are carried out safely and effectively, secondly that they enable social work staff to be supported, accountable and effective in their practice, and thirdly how it assists social work staff to uphold core social work values. So there are a number of reasons why we undertook the review. It was part of the Care Inspectorate Scrutiny Plan for 24-25, which is agreed with Scottish Government. We were kind of very conscious that in the old days of the SWEAR inspections, where we did whole social work inspections, quite a long time ago now, there'd been quite a big change in the social work landscape. So the opportunity to look at something across all of social work was something we thought was valid and valuable. We wanted to seek to further understand how social work operated within health and social care partnerships and within other partnerships, for example, those children's partnerships which operate quite often with education services and so on. And we wanted to look at opportunities and barriers to undertaking statutory social work duties. We were very conscious of many of the pressures that were around social work, but we wanted to understand that better so that we could help to support the sector in amplifying some of those challenges. We were aware of the changing landscape, and in particular some of the proposals around the National Care Service and the National Social Work Agency, which were very high on the agendas of pretty much everybody at the start of the review. So we wanted, again, to kind of understand how that was impacting. And we wanted the opportunity to share knowledge widely and nationally across Scotland. So that was something that we wanted to be able to bring to the sector. Thanks, Ash. So the things that we wanted to achieve were really to put forward a national picture on how social work governance and assurance arrangements were managed, how social work duties are managed particularly within HSCPs and other partnerships, and how that worked, and also how staff are supported and managed in their practice. So to talk, just to let you be aware of how we approach this, what we call in Care Inspectorate language methodology, which is just the tools by which we gather our evidence, really, is all that means. So we wanted to have minimal impact on social work services as much as possible. So we didn't use approaches that were really burdensome on social work time. In general, people just had to send us some stuff and attend a few meetings. We weren't doing file reading exercises or doing a lot of deeper dive activity in a small number of areas, so we decided not to do that. We wanted to take an appreciative inquiry approach. That just means we wanted to approach it positively. We weren't there looking for faults. We weren't there to try and find areas of failure or areas where things weren't working. We wanted to use the opportunity to try and, if possible, celebrate some of the positive things social work was doing. We had developed a number of key lines of inquiry, and those tended to focus around governance, assurance arrangements, which included approaches to performance and audit and management of risk and so on a corporate, on a strategic level. We wanted to look at workforce and how workforce were supported to undertake their duties, and we had a focus on values and social work values in particular. The Care Inspectorate utilises a European Foundation for Quality Management approach. This isn't something that many other areas use. One or two local authority areas do use it, but not many. But it's an approach that enables us to focus on particularly the approaches taken to do things, which is direction, how things are actually undertaken, which is execution, and results, which is what the outcomes for those activities are. So EFQM is based around those three kind of core principles. Thanks, Ash. Okay, so the evidence that we received and the sources of the evidence we received and the approach taken. So we looked at a range of literature that was national and in the public domain. Some of this was guidance to chief social work officers, and there were other bits of literature that were published, bits of research and so on. So we looked at that, and we also looked at something like it was 1,032 core documents submitted by local authority social work services. So we had asked people to give us a range of about 7 documents. Some of them were like performance reports, governance charts, risk registers, that kind of thing. So we asked for examples of those from each of the 32 areas, and we received just over 1,000 documents in the end, which we read and analysed. We undertook 32 structured interviews with each of the chief social work officers. So that was all local authority areas took part in that. And those interviews also included one or two other key social work leaders in Scotland across local authorities. Sometimes they were heads of service. Other occasions, some chief officers joined those discussions. There was 8 chief officers joined those 32 structured interviews at different points. And so there were, a range of different people that we talked to at that level. We had additional conversations with 8 local authority chief executives. So we issued a kind of invitation to Solace, which is the national body that represents local authority chief executives, and asked if any of them would like a conversation with us, and 8 of those came forward, which, as it happened, represented a whole range of different approaches and backgrounds and so on. So we had representation from the islands, from the central belt, south, north, east, west of Scotland. So we were lucky to have really valuable conversations with chief executives on that front. We issued a workforce survey targeted really at first line managers and frontline social work staff. And we received something like 3,935 total responses to that. So that was a really, really positive response that we got. We were quite conscious that there are a lot of surveys knocking about, staff surveys and so on. So we were kind of really appreciative of the time that people took to provide responses to that. And in addition to those bits of activity, we undertook to do 18 regional focus groups on core themes. So we kind of split Scotland into regions. So we had, for example, Grampian or the Lothians, and had a focus group that looked at governance, that looked at assurance, and looked at workforce. And throughout each of those 3 focus groups, we threaded values through those 2. Thank you, Ash. So a good range of evidence that we got. I'm going to hand over to Belle firstly, and my colleagues are now going to take you through the key messages and talk you through some of those findings in a little bit more detail. So Belle, thank you, and over to you.
Thanks, Tim. Just before I start, folks, we've had a couple of messages for some of you not being able to see the slides or sound going. It looks like it's all functioning at our end, so the best I can offer you at this point in time is to come out of the call and maybe rejoin and see if that works for your functionality. However, as James has already responded in the chat, we can share the presentation after the webinar, and as Tim has said at the beginning, we're also recording the webinar, so if there are serious connectivity issues, there should be a recording for you to view, at the very least. So apologies for that. It looks like it's working on our side, so I don't know if it's something with internet connection or something. So please do try and maybe leave the call and rejoin again. Okay. So with that said, and housekeeping out the way, we'll just get back to our key messages. So the first area I want to talk to you about is the clarity and understanding and effectiveness of governance arrangements. So in relation to governance, our key finding was that our key message was overall social work leaders and managers worked effectively within often complicated governance arrangements. And in most cases, these arrangements were well understood by staff. So breaking this down, while governance structures for social work were effective in most instances, we did find at times that the capacity of leaders and managers to oversee social work functions was a challenge in some areas. Now, we recognised the current context is challenging in terms of capacity and resources, so there was some impact from the conditions in terms of the ability to oversee social work functions. There was also an issue at times with the role and functions of social work not always being well understood in health and social care partnerships. Now, a lot of variables contributed to this. For example, to what extent social work was part of the health and social care partnership, the size of the social work estate, leadership, the governance arrangements, all of this played a part. There was no one thing that we could point to, but it's important to have a think about that in your health and social care partnership. To what extent are the role and functions of social work understood? And there were also the reverse. There were good examples of good understanding. Now, we did note that structures tended to look clearer, and we heard that they were clearer when all social work services were delegated or within one health and social care partnership structure. But we really need to stress no one model was best. What was more important was that the mechanisms that were put in place to ensure clear line of sight to social work activity were robust. And there were good examples of this in areas where social work functions were shared across council and health and social care partnership. So we really need to stress, well, it looked like it was clearer structures. No one model was best. The people were really important. The leadership were really important. The mechanisms were really important. Now, using importantly again, I would say importantly, governance arrangements for public protection through chief officers groups were effective. Now, this is unsurprising given the amount of focus that every area has on protection arrangements, and it was a particular strength in terms of clarity of accountability, really, across the piece. But there wasn't any consistency really as to who the chief officers groups subsequently reported on to. So that was quite variable depending on which partnership you were in. Now, moving on to in terms of how well governance arrangements were understood. Frontline managers and staff had helpfully strong levels of understanding of governance arrangements. Now, when we'd undertaken our staff survey, 94% of staff who completed our survey agreed that they understood line management and reporting responsibilities. So that's really providing a good level of reassurance. And there was also, across the board, professional relationships being recognised as important and being valued by all levels of social work staff. However, lines of reporting for social work leaders and managers were not always clear. Now, sometimes this was resulting in duplication of reporting to the health and social care partnership and the local authority. So, at that higher leadership level, there could be some duplication. And while local authority chief executives were, the ones we spoke to were really confident that they had a strong oversight of key areas of social work, some chief social work officers found it challenging to maintain oversight across multiple governance structures. Now, helpfully, the Chief Social Work Officer annual reports were really recognised as a helpful mechanism for illustrating the transparency of governance. And I think that is a really important tool for Chief Social Work Officers. So it's worthwhile for those of you contributing to these types of reports to maybe even review what peers are producing in other partnership areas, really to ensure that this provides the maximum opportunity to raise awareness of governance arrangements and address social work activity across the board. So just to sum up, where we had the strongest examples, there were clear lines of accountability. There were helpful things like structure charts and governance frameworks that promoted visibility and understanding across social work staff and other staff. There was clarity between what was meant by social work and social care, and that really clear about what the functions were. And there was straightforward accountability and streamlined reporting. So there was efforts to reduce duplication. So that's what we saw in some of the strongest examples. Now, in terms of oversight and breaking this down, the levels of oversight and assurance were enhanced by dedicated social work governance boards or their equivalent. So where in place, dedicated social work committees supported a clear understanding of social work and its challenges. But we did find that arrangements for oversight of social work by elected members within councils was inconsistent. So some had particular committees, some had particular boards. And where we had, for example, these social work governance boards, we felt it really supported social work leaders to have appropriate levels of oversight and assurance and feed into elected member committees and so on and so forth. So the strongest examples there were the ones that had specific strategic space for consideration of social work issues. where there was valued positive relationships, it was visible, accessible leadership, and where leaders had a good understanding of social work functions and the value of those. Now, there was an important comment about the role of the Chief Social Work Officer and the importance of their involvement in really raising social work functions, social work value. One chief executive that we spoke to talked about the importance of the Chief Social Work Officer having a seat at the table and flagged that actually there were risks of having the role of the Chief Social Work Officer too far away from the Chief Executive and the leader of the council. So it's important for people in those roles to have a think about how accessible are the Chief Executive, the leader of the council, those meetings where you needed to have a level of influence. Next slide, thanks Ash. So just thinking about now the role and influence of social work. In terms of influence, our key message really was around social work influence at times being a bit more limited within health and social care partnerships, but it had a less equal level of representation. So breaking this down, oversight of all the aspects of social work within clinical and care governance arrangements could be inconsistent. Now, this was influenced by the extent to which social work services were delegated to health and social care partnerships. And again, no one model was better or worse, but we did see cluttered agendas in some instances. So it's important to be mindful, if you are part of those meetings or creating the agenda, to really have a think about to what extent can sufficient time and thought be given to social work issues. Might need to think about doing something different or a different way of really highlighting the social work concerns. We also noted that some social work leaders found it challenging to have their voice heard equitably within health and social care partnerships. So for some social work leaders, they talked about, we had comment from one saying, I have an equal voice, but I'm amongst a number of other voices. So if you are in a health and social care partnership where your social work leaders are in the minority, it is important to think about how you ensure social work concerns are heard, how they're given an appropriate platform. We also noted that some traditional social work duties and roles that were not defined in legislation were being delivered by other staff or professions. So this was some of the concern that was being reflected back to us by staff and leaders. Now, there is a question about the balance of the precious resource, so the precious social work resource, and actually what we can live with being delegated. But it's an important point, as one participant highlighted to us, there would be outrage if a teaching post was really replaced by a non-teaching staff member. So there does really need to be some thinking about this. How do we protect the social work resource? How do we recognise and highlight the value, but also appropriately delegate when that's required? So definitely something to be thinking about there. There was also some instances where service delivery priorities were perceived by social work leaders and operational managers to be more dominated by health and to a lesser extent education. Now, we found that common in just over half of local areas. Now, it depended on where in the landscape social work functions were. But for example, some areas felt that the conversations were dominated by delayed discharges. And again, I think if we're in those situations, we need to think about how to achieve equal space for other social work concerns to make sure that we're paying due regard to the other important social work issues. But importantly, at an operational level, social work's role and influence tended to be stronger. So most staff and first-line managers felt valued when working as part of a multidisciplinary team and felt able to influence that multi-agency working. So it's really helpful to understand that at that ground level, that role and function of social work is still delivering. So the strongest examples had clarity about the role and value of social work amongst leaders and staff, and a clear, agreed social work agenda and equitable coverage in shared agenda spaces. So again, just think about how we pull out and highlight the concerns for social work. Now, thinking about role, overall, the role of the Chief Social Work Officer was important in promoting and amplifying the voice of social work. So breaking this down a little bit, social work leaders, we found, were using a broad range of opportunities to influence social work staff at all levels. Some of that was through structures and types of meetings, and others were opportunities for celebration, National Social Work Day, type things like that. We heard that Chief Social Work Officers had also positive and frequent levels of contact with local authority chief executives, providing good opportunities for influence. So overall, Chief Social Work Officers were reporting that was working well for them. And also, Chief Social Work Officers, we found, were playing a critical role in promoting the role of social work. Now, there was a variety of arrangements in relation to the role of the Chief Social Work Officer. A few had no operational responsibilities, the rest had varying degrees of operational responsibilities. And again, no one model was better. But what was helpful where we saw it was that I think we saw it in just under half of local areas, there was a principal social worker or a deputy chief social work officer post or equivalent. And where such posts existed, they've helped provide a stronger level of coverage for social work issues across the multiple structures. And particularly, I think, in health and social care partnerships where social work qualified leaders were less prevalent. So really where you had those chief social work officers and deputy or principal arrangements, it really helped support the chief social work officer, make sure that there was that line of sight across all the social work functions. So the strongest examples had arrangements that ensured the coverage across social work functions, visibility and accessibility for staff in relation to their chief social work officer, and chief social work officers were represented on decision-making forums, for example, executive management meetings, things like that. So the strongest examples basically had the chief social work officer in the room to be able to influence decision-making. Now we now move on to James, who will take you through the next series of key messages. Thanks.
Thanks, Belle. So yeah, I'm going to talk briefly about our findings in relation to social work values, and then I'll move on to talk a wee bit more about assurance and oversight of risk, some of which Belle's already touched upon. So our key message from around social work values was that staff, managers and leaders felt confident to promote and uphold values within social work services, and a strong belief that the importance of social work values was there to kind of support ethical practice. As we stated in the report, we found that overall professional values underpin decision-making and ethical practice at all levels of social work. While there isn't a clearly defined set of social work values that are adopted universally for social work in Scotland, you'll all be aware that BASWA Code of Ethics sets out 3 central values which underpin social work practice. These in turn are drawn from the International Federation of Social Workers' global definition of the social work profession. So those 3 values are human rights, that social work is based on the respect for the inherent worth and dignity of all people. Social justice, that social workers have a responsibility to promote social justice in relation to society generally and in relation to the people with whom they work. And finally, professional integrity, that social workers have a responsibility to respect and uphold the values of the profession and act in a reliable, honest and trustworthy manner. Now, while the SSC codes of practice don't explicitly set out a set of core values, they do share implicit commonalities with the BASWA Code of Ethics. For example, under the value of human rights, the Code of Ethics includes principle of respecting the right to self-determination, which states that the rights of people to make their own choices and decisions should be respected and promoted irrespective of their values and life choices. That principle closely aligns with the first standard for social workers within the codes. I must protect and promote the rights and interests of individuals and carers, which again refers to promoting choice, values, and the person's right to control over their life. During the review, we found that the SSC codes were the most commonly cited framework for promoting values and embedding ethical practice, which was good because it's one of their intended purposes. Throughout the review, we heard examples of values being embedded into everyday practice. We heard about values being used as a kind of lens for both team and manager meetings. We heard that values were very much embedded in recruitment processes, so that kind of sense of sort of values-based interviews. They were something that were used to promote effective supervision of staff. And we also heard from areas that were taking, I guess, a more nuanced approach to caseload allocation and management, shifting from from numbers to considering more about complexity and consideration of the areas that staff were operating in. So if they were operating within areas of kind of higher deprivation, what this allowed was staff were able to were then given the kind of capacity to uphold a kind of more person-centered approach. We also heard that learning and development for staff was an opportunity to again reinforce and promote values. Of particular note was multidisciplinary learning events, which gave the opportunity not just to kind of promote values within social work, but to share that kind of sense of values with partners from non-social work backgrounds. Additionally, we heard that student placements offered I guess, an opportunity for a renewed focus on values for those teams that were hosting the student. So bringing values back into kind of focus for those teams. Overall, from our staff survey, we were encouraged to hear that the majority of staff felt supported to uphold social work values in their role, even in the context of high demand and limited resources. We also found that staff, their active involvement in adult and child protection committees presented an opportunity to share and model those values, again with people from out with the social work profession. In our report, we highlighted the example of Renfrewshire, who used World Social Work Day to kind of bring values kind of into focus. The way that they did that was using the opportunity to reflect on how social work values are central to social work practice across the board, regardless of the different areas of social work people worked in. And I guess this was significant given some of the comments that we heard during the review that at times social work has kind of felt a bit fragmented within kind of wider partnership arrangements. Belle's kind of touched on this, but at kind of strategic governance level, the role of Chief Social Work Officer, Deputy Chief Social Work Officer, and Principal Social Worker, where those roles existed, those really helped to promote a shared understanding of the social work role and those underpinning values. This was particularly impactful in the context of wider health and social care partnerships and children education partnerships, where, as Belle has already mentioned, social work representation was smaller, the kind of smaller part there in amongst all that. In the report, we've kind of suggested some areas that to maybe consider for moving forward. So thinking about opportunities to promote social work values. So could that be done through strategic documents, specific events like the one we've highlighted in the report, ensuring that it's embedded firmly in those kind of recruitment processes, and particularly in the context of wider partnership working. Given the centrality of values that we've heard in social work, it's key that those values are understood beyond those professions so that they understand why you do things in the way that you do it. We also wondered, so I mentioned that the SSSC don't explicitly state a set of core values, but we wondered whether making values more explicit might help in their promotion, and again, particularly in that context of partnership working. So those are things to maybe kind of consider. I'm now going to talk briefly about assurance and management of risk. So Ashley, if I could ask you to move on to the next slide, please. Thank you very much. So our key messages in terms of assurance and management of risk were that overall social work assurance was mostly effective. Social work services were managing significant levels of risk relating to financial and staffing resources. And what we found, and I'll touch upon this a wee bit more, is the impact of both of these risks was amplified in island and rural settings. So in terms of the effectiveness of social work assurance, we found that social work assurance mechanisms were generally found to be effective across most local areas. Encouragingly, those chief executives that we spoke to indicated that they had a good grasp of social work priorities, and many local areas that demonstrated good performance data sharing. Again, Belle's kind of touched upon this, but Chief Social Work Officers were well informed in the full range of social work duties and priorities and used this information to inform planning, delivery and improvement of services. We did find that sometimes adult social work outcomes were underreported, especially where social work was embedded within a kind of larger health structure. In terms of performance management, many areas told us that they were experiencing challenges due to outdated and or inadequate electronic case recording systems, which in turn limited accurate performance tracking and reporting. Many of the areas that we spoke to told us they were in the process or planned to implement new systems, but they also highlighted that this was a significant cost for the local authority. We found that some performance reports didn't always reflect the full scope of social work activity. Impact and outcomes for people was less well reported. Now, it's not popular to quote Morrissey these days, but I'm kind of reminded of the title of the Smiths song, What Difference Does It Make? Completely different context, of course. What we did hear, though, was it was something that services were aware of and were making efforts to address. We did hear examples of case studies being presented to strategic forums, which provided those in attendance with a fuller picture of what difference social work was making in people's lives. So it's something that's worth doing. Long wait times for people in need of services was highlighted as a concern for some areas, and that wasn't always fully reflected in performance reporting. One issue that we heard quite a lot from feedback from staff was frontline staff didn't always feel fully connected. Didn't they understand the need for data recording? They didn't realise what impact that would have in terms of informing service planning, improvement activities and funding allocation. Staff felt like sometimes they were just feeding data into a computer. What we did find, though, was where there was an effective recording system and staff were confident in the use, reliable data was being used to demonstrate impact and outcomes. In terms of oversight and management of key risks, it goes without saying, but I guess I'll say it anyway, that social work operates within a highly complex and increasingly risky environment due to legislative demands, staffing shortages or skills gap, and financial constraints. What we found in the review was that risk registers were commonly used and generally effective. We analysed many risk registers which were detailed, dynamic, clearly articulated the risk owner, what actions were required to reduce and mitigate the risk, and the frequency of the review. Other risk registers we reviewed were high level and did not fully consider social work issues. Examples of the ones that we looked at, and we didn't look at every risk register in Scotland, to be fair, but areas that we didn't always see included were stuff around MHO capacity, support for unaccompanied asylum seekers, and foster care availability, just to cite some examples. Encouragingly, almost all staff that responded to our survey indicated their confidence in the systems and processes to escalate risks and concerns. So they were really confident around that. As Belle alluded to earlier on, complex governance structures sometimes led to duplication of reporting. So we heard that often leaders were required to report the same risks, but in different formats in order to kind of suit different governance groups. This was particularly evident within the context of health and social care partnerships. This meant that the ownership of the risk was not always as clear as it might have been. There was some concern that challenges and risks and their impact was not fully appreciated by those out with social work. And by those out with social work, that includes perhaps elected members, other professions, and indeed the wider public. So just to talk briefly about staffing pressures and oversight of financial resources. This comes as no surprise to anybody that's on this call, but recruitment and retention was a key issue for most areas, and was indeed identified as a corporate risk. The so-called Great Resignation during COVID had left an experience gap, We heard that applicants for posts did not always have the required levels of experience, and areas were sometimes reliant on newly qualified staff. But due to that kind of loss of experience during the Great Resignation, there was not always the complement of experienced staff to support the development. So that kind of added additional pressure to those that had been around and were experienced. As I mentioned at the start, these issues were exacerbated in remote, rural and island communities, where generally there were fewer prospective candidates, and also kind of further barriers around, kind of cost and availability of housing and travel issues. Those also presented as kind of further barriers. That's not to say that urban areas were without their challenges, and what we heard was that there was often strong competition in terms of pay conditions for the same pool of potential applicants. And again, that pool of potential applicants we heard was generally smaller than it might have been in previous years. Different challenges need different solutions, but one thing that we heard was quite common was a kind of a move towards grow your own by supporting existing staff to complete their social work qualification. What we did hear, though, was given the scale of recruitment and retention issues, while local innovations were helping, we heard that they were sometimes maybe perhaps a bit of a sticking plaster, and perhaps a national approach to recruitment and retention was needed. So that's probably something that would merit further discussion. Capacity to meet people's needs was a challenge. A restrictive financial climate meant that staff felt service delivery was, at times, resource-led rather than needs-led. Areas told us they were making difficult decisions about service delivery. Structural changes were being implemented and services, where possible, were being streamlined. What this often meant was that there was kind of reduced business support, which obviously the kind of flip side of that was there was an increased administrative burden on frontline staff, and the word burnout was used as part during our review. Again, availability of services disproportionately affected rural and island areas, where access to specialist services, so for example, secure placements for young people, had a greater impact in areas with just generally a smaller budget. So overall, we found that governance arrangements were providing strategic and social work leaders with the appropriate assurance and oversight of risks against a background of significant challenges. Again, we kind of posed some kind of questions for reflection, I guess, and we suggested that there may be opportunities to consider how to improve buy-in from staff around performance data. Also to consider the extent to which all areas of social work are being represented through performance reporting at key strategic forums, and ensuring that risk registers capture the full range of risks. Like I say, we don't look at every risk register, but just to ensure that risk registers are capturing those full range of risks and that they're reported in a kind of meaningful way at those appropriate forums. I'm now going to hand over to Susan, who is going to talk a wee bit more about workforce issues. Thanks.
Hi, thanks, James and Belle. So I'm going to talk just really about the arrangements that we found that were in place to enable staff to be supported, accountable and effective. So as you know, Tim mentioned at the beginning that we had a staff survey. We had nearly 4,000 responses to that. And just for information, it's in the report, but the breakdown, 35% of those were frontline social workers, 24% were frontline managers, 8% were in a variety of other categories, 7% were senior practitioners without any management responsibility, and 4% were occupational therapists. So overall then, staff felt that they were supported to deliver effective services. So looking at that in a bit more detail, staff felt they were confident in having good conversations with the people they were supporting. And overall, the systems and processes that were in place in the local area supported them to deliver interventions that did help people have good outcomes. However, having said that, has already been highlighted and mentioned by James, there was a concern that was kind of threaded through the work that the sort of traditional relationship-based practice that we would see in social work was being replaced by a more transitional or episodic type of engagement, and that was particularly the case in adult social work services. Also, as you can imagine from the information that James has just talked us through, staff felt they didn't really have the capacity to be as responsive as they would want to be, and that was mainly due to the size and or the complexity of their workload. We did see positively evidence of caseload protection for newly qualified staff, which was positive, but obviously that then had a knock-on effect for more experienced staff who had higher caseloads, more complex caseloads. And this often, together with hybrid working, which is still in place in some areas, that then had further an impact on qualified staff ability to mentor new qualified staff, which then has an impact on the other issues we're discussing. We saw this increased demand and complexity and risk in the people that social workers supporting was having a negative impact on staff members' wellbeing across all social work services, and that's been widely reported in other forums, and that also was having an impact on recruitment and retention abilities. James mentioned about waiting lists and waiting times. Staff members were less confident about how well people who were on a waiting list for assessment were being kept up to date about progress, and also whether the systems that they had in place were to keep people informed about progress on the waiting list were actually effective. So if I move on now to specifically around professional supervision and learning and development opportunities, most staff said that they did have appropriate professional supervision and access to learning and development opportunities, which did help them in their role. So if we look at that in a bit more detail, 79% most staff members felt confident that the supervision and the support direction that they received did help them undertake their statutory duties. It did vary a little bit across services. One example was that out of hours staff reported we noted they were less confident about this. Most staff had day-to-day operational management around caseload, around particular tasks, as well as professional support from somebody of the same profession. Some arrangements, supervision arrangements, were adapted because of integration arrangements, and so, for example, you might have a line manager from a different profession. Staff members said that they had access to special advice when they needed it, and nearly all staff were confident in raising any concerns or any risks with their line manager. And in tandem with that, managers and leaders we found were confident, were clear that they understood the importance of supervision, support and direction for both staff well-being and effectiveness. And we noted a strong improvement agenda across the sector to enhance supervision and support well-being. There was a particular recognition of the skill and knowledge required by managers with an emphasis on investing in them to provide good quality supervision. We did see a number of different measures in place to support well-being through supervision and support. So some examples were areas that had set up hubs and academies for students and newly qualified staff surveys and audit activity to support the review and revision of their supervision policy, development of a quality assurance approach linked to supervision, and of course, I've mentioned the training and support for managers who are delivering professional supervision. Learning and development was seen as an important way to support the quality of social work practice and also contributing to service development. And we saw the availability of learning development was seen to contribute to the ability for recruitment and retention. That was a positive thing for staff. It was also a key way that staff felt that they were valued and appreciated by their organisation. We did see some variance, as you would imagine, across areas about how they were approaching identifying training needs and delivering learning and development around social work practice. So, for example, in some areas, they had dedicated social work training resources and therefore were able to invest in dedicated learning for social work practice. Whereas other areas had corporate resources, and those tended to be split between the partnership and the council. Some areas did carry out training needs analyses, and then they put a workforce strategy in place to address these. What was clear was that public protection was a clear priority, and almost all staff were up to date in this area. Some of the challenges around learning and development are similar to those that James has highlighted, for example, around travel, for face-to-face training, particular issues in remote, rural and island areas were kind of impacted more significantly. And because of the workload pressures, being able to access non-mandatory training was more of a challenge across social work areas. We also saw that limited evidence that local areas were actually evaluating the training that was provided, that in terms of its impact or its effectiveness, that kind of so what that James mentioned, how are areas assuring themselves that the learning and development is making an impact on the quality of social work practice. And then finally, we did notice a few areas for development, and these included adults with incapacity legislation, self-directed support and person-centred approaches in general, unpaid carers, and outcomes-focused relationship-based practice, which that kind of touches on some of what James was talking about with this shift from relationship-based practice to a more kind of transactional engagement approach. So that covers all of the key messages around support for staff, and I'm going to hand back to Tim now. Thank you.
Thank you, Susan. Nearly there, folks. So I just wanted to touch on 3 high-level messages that we identified in the report that we felt needed to be taken forward on a national basis. So not all of the areas that we came across were things that local authority areas by themselves could manage. So there were 3 of those that really needed to be taken forward by Scottish Government, by the national body, Social Work Scotland, and so on. So the first of those was that Scotland social work services were finding the ability to match supply with demand, that being exacerbated by increased levels of complexity. So that James was talking through there the challenges around financial constraints and also staffing constraints. So there was a concern that in some cases the ability to fulfil statutory duties and ensure people's rights to receiving a service and so on, that was being impacted by capacity, but also as the years have progressed, the support required by individuals and individual needs were becoming much more complex. So that really needs to be understood more on a kind of national level, and some actions being taken nationally to try and help support local authorities to manage that. Thanks, Ash. So the second, Susan has touched on this already, but that traditional relationship-based practice was being replaced by transactional episodic engagement in some ways. That was particularly the case in adult social work, but also in some regards in children's services, particularly children with complex disabilities and so on. So some of the relationship-based practice there was being impacted. This had been identified in a review we published last year around children with a disability. We did a thematic review around that, and it was noted there that generally it felt like social work's ability to maintain relationships over a long period of time was being impacted. And again, that was identified as a national theme and something that needed to be understood on a national basis to make sure that those relationships that people form with social work staff were able to be continued. Okay, thanks, Ash. And finally, the third high-level message was that the recruitment and retention crisis was such that social work's sustainability was being particularly impacted by that financial position and the staffing situation, the main two risks that virtually everybody identified that we talked to. So whilst there was a lot of creative attempts being made locally to increase staffing and so on, grow your own approaches and all kinds of different stuff like that, that's not sustainable in the long term for social work. So there's a national approach required to ensure that recruitment of sufficient numbers of appropriate staff is undertaken. And similarly, after, I don't know how many years it's been now, since 2008, the financial crash that happened in 2008, every single year after that, the level of resource available to social work has reduced. That, again, is not something that can be sustainable in the long term if social work is to continue to deliver on its statutory duties. Some work has to take place nationally to understand that and to ensure that social work is given the right level of resource and the right level of focus. So that was an important message we thought needed to be taken forward nationally. I don't know whether that's the new National Social Work Agency or whether that's Scottish Government or that's a collaboration between a whole range of national bodies, but that's very important that conversation happens. Thank you, Ash. Okay, there's a couple of short additional points. So when we published the report on the 6th of May, we sent each local authority their own staff survey results alongside the national ones. That was really to enable people to benchmark themselves against against the national staff survey findings. So hopefully that's something local authority areas can use to develop their approaches, to develop the confidence they can have about their governance and assurance arrangements. There is also, just to highlight, there's a section at the back of the report which has a range of reflective questions which will enable self-evaluation and improvement activity. So if areas are able to look at those questions and ask themselves whether their arrangements are as strong as they can be, they're just helpful additional points.